English, not like Professor Louvain. So it's not easy to speak after high topics such maternal mortality. So infertility is also a very important health public issue. And I would like to speak today concerning the unexplained infertility. And we are going to speak about some point of H3 guidelines. And I say the Professor Louvain, guidelines are important to fix rules, but we have to discuss this for our country. That's why we did in France with Sengoff. So I will focus on some points concerning diagnosis and infertility management. So nobody. Okay. Do you have maybe in Vietnamese? Because you have in Vietnamese? Okay. Okay. Nobody doesn't really agree about the test to prescribe for concluding to an unexplained infertility. So it would be an exclusion diagnosis when you find that all is normal. But what is a normal ovarian function, a normal uterus, a normal sperm? And for me, normal doesn't mean anything. Normal is just sitting on the washing machine. So, and I was a little surprised concerning this definition, concerning H3 guidelines. Because if we say normal, but we exclude what? The female age. After 35, 40, what is a normal age? BMI, more than 30. Do we take in account environment and toxin? We can be normal with stage 1 or 2 endometriosis, but we don't know we have one. And can we have a normal sperm, but quality concern of sperm? So first in the H3 guideline, I was surprised because they don't speak a lot about lifestyles. And as underlined Frank Louvain, in Vietnam you are the BMI you are thin, you eat very good food, very healthy food, not like US people, for example. You don't smoke, but they only recommend healthy diet and regular exercise. That's all. So I like this whole study that is still relevant. It's concerning the spontaneous pregnancy rate, and for a couple who haven't any negative lifestyle factors, the chance to have a spontaneous pregnancy in 12 months is 83%. However, if the woman is old, the man is old, if there is tobacco or high BMI, you lose your chance of spontaneous pregnancy. So, is it an idiopathic infertility or not? I think that lifestyle can explain infertility, and we have to look after that. So I conducted a study in French centers, And I asked to my colleagues, which test do you perform before concluding to an unexplained infertility? And I would like to share with you, what do you prescribe? And we recorded that a lot of my colleagues prescribe postcoital testing. 35% of my colleagues prescribe a pelvic MRI before concluding to unexplained infertility. And you see that about 20% of my colleagues do a laparoscopy before diagnosis unexplained infertility. So I knew, what do you do? And I was very surprised to see the age of 40, below which Eshrei conclude to have an idiopathic infertility. In my opinion, I don't agree with the definition of 40 years of this threshold, because we know that the spontaneous fertility of a woman starts to decrease after 31 years. So it's very huge. Sorry. I have a problem with the laser. Okay. I have no laser. So the spontaneous fertility of a female decreases after 31 years and a lot after 35 years. So for me, between 35 and 40 is not really an explained infertility. For me, it's an age-related maternal infertility. And so let's come back to the Eshrei guideline. What? Okay. Let's go back to the Eshrei guideline. They think that that you can conclude to unexplained infertility if you have got regular intercourse after 12 years, and if you have got regular cycles before 40. Please, my previous slide, please.
You will point this to the computer and then hold it to the screen so that you can use the laser.
Okay. If your cycles are regular, if sonography, 3-day sonography is normal, if hysterography or hypophysis is normal, if sperm parameters are normal, and they don't recommend to do postcoital testing. It's surprising to see that hormonal tests are not recommended at all to identify etiology of infertility. Or we could talk together about the diminution of ovarian reserve that sometimes could explain explain a low oocyte quality. So, if we come back on, if we have a look on this guideline, you see that the only one exam to do for infertile women for testing the uterine factor is to do ultrasound 3-day. And that's all. In first intention, there's no recommendation for MRI and no recommendation to do hysteroscopy. And we are going to discuss further the place of the laparoscopy that is not recommended by Eshrei in case of unexplained infertility. And again, the test postcoital is no more recommended for this kind. During this time, I think it's important. I don't know if Vietnam, you have your own guidelines for fertility and infertility management. So we also did our guidelines after a systematic analysis of literature. And Professor Bouet conducted analysis of literature. Is coming in 1 month with me. And he concluded that at this time, the sonography 3D is as good and as specific and sensitive as hysteroscopy plus laparoscopy to do malformation diagnosis. So we joined the guideline ESHRE to do only a sonography 3D, and we also don't recommend to do hysterosonography, MRI, nor hysteroscopy in case of unexplained infertility. Okay, concerning the tubal factor testing, which test have we to do? You can do hysterosalpingography or IFOSI. It's the same, but it's only interesting for the negative predictive value. And so I don't know which test, which exam you do in Vietnam. It depends of your habits. And we will discuss the place of chlamydia antibody testing. And we did a systematic analysis of literature in France with CNGOF. And I think the important results are just here. It's a negative predictive value of chlamydia trachomatis testing is high, 88%. So it could be interesting to place your patient in a low risk of tubal pathology. However, the predictive positive value is very low because there is cross-reaction with the other kind of chlamydia. So you can't use the chlamydia trachomatis testing to know if there is or not tubal damage. An important point for me is to discuss the value of the laparoscopy in unexplained infertility. Because I was surprised to read that routine laparoscopy is not recommended for the diagnosis of unexplained infertility. But routine not recommended doesn't mean never. I think that there is a place for laparoscopy in this woman. Why? Let's have a look on some studies. Okay. In this first study on 47 women with an unexplained infertility, our Japanese colleagues found 81% of tubal damage or pelvic lesion. And what is important is that when they treat this pelvic damage, adherence, stage 1 or 2 endometriosis, the important point is that there is 82% of spontaneous pregnancy after 6 months post-laparoscopy. And it's interesting in young women before 30. That's why in our French recommendation, the the team of friends from Rennes, Professor Lavoué, sorry, I come back, recommended to consider to do a diagnosis laparoscopy before 30 years when there is an unexplained infertility, because sometimes laparoscopy could explain the infertility. And so let's have a look on other study. It's a retrospective Japanese study on a cohort of female of 32 years. They studied two groups. One group who underwent a laparoscopy and an IVF 6 months after if they were not pregnant, compared to a group of women who underwent IVF in first-line strategy. And so, again, they found a high rate of pelvic adherences or endometriosis in infertile women with unexplained infertility. And you see that only 17% of women presented a normal laparoscopy. What is important, if your goal is to have a baby, you can choose the strategy 1 or the strategy 2, okay? Because at the end, the live birth rate was similar between the strategy 1, laparoscopy, then IVF, versus IVF in first line. But it's not the same price. And moreover, you see in the first group, 31% of spontaneous pregnancy after laparoscopy. So what is important too is that the spontaneous pregnancy occurred in the 6 months after laparoscopy. So it's in young women, I think we have to consider laparoscopy in case of unexplained infertility. To sum up, this meta-analysis reported 44% of stage 1 or 2 endometriosis in case of unexplained infertility. Why is it important to diagnose stage 1 or 2 endometriosis? Because this old study, but very with a high impact, because if you treat the stage 1 or 2 endometriosis, you increase the rate of spontaneous pregnancy after the laparoscopy. I hope I have convinced you. So the Reichsweg guideline point to look after autoimmune pathology. And I was surprised when I read this guideline because they recommended to test celiac disease in women with unexplained infertility, and they also consider that TSH measurement is normal testing. In Vietnam, there is no much gluten in your food. However, I look after there is gluten in soya sauce. Okay. And why this recommendation? Because in the general population, celiac disease is not rare, almost 1%. And this meta-analysis reported that you have a 5 higher risk to have celiac disease when you present an unexplained infertility. So after this meta-analysis, they write this recommendation. And moreover, if you have celiac disease, it increases the risk of fetal loss, intrauterine growth restriction, and prematurity. When we are physicians and we have to deal with unexplained infertility, we are attempt to prescribe a lot of tests. And so you can look on this slide what to not do. So it's curious because we just have to do one sonography to test to find after celiac disease, to test tubal patency, to do test sperm analysis, and that's all. Okay, and so you can see all these tests. You don't have to do them unless you do research, and especially. I don't know if it's a fashion in Vietnam, but in Europe it's a big fashion to test the vaginal microbiota and to try to do a link between vaginal microbiota and infertility. I think there is a link, but it's too early to know what to do and to know how to treat. And so, as underlined by this very famous author, specialist in microbiota, please remember that there is no consensus today about what constitutes a healthy human microbiota, and we don't know if your microbiota is, we know that your microbiota is not the same that in Europe or in America. So, but it's a very interesting way of research. So I have a few minutes to discuss the management of infertility, unexplained infertility. And a lot of my colleagues are doing first IVF with ICSI. I don't know what you do if you don't understand why your couple is infertile. And you see this strong recommendation in case of unexplained infertility. We have to do first intrauterine insemination. It's recommended at first line. And you see that IVF is not recommended over IUI in first line, and ICSI is not recommended too. And if you do IUI or induction ovulation, don't use clomiphene citrate in this case. It's not recommended. And if you do IUI, it is recommended to do ovulation induction, but with gonadotropin. You see that with gonadotropin, you can you increase by 2 the rate of pregnancy without having too much twins. And this study is very interesting because sometimes we could be attempt to do an IVF because we think it will be give better result. And you see that if you do 3 in this randomized study of Benmol, if you do 3 insemination, you will have the same pregnancy rate than after 1 IVF with an elective embryo transfer. And so it's the same rate, but it's not the same cost. And I think it's important in if you work in an art center to measure in your center the prevalence of idiopathic infertility and to look your results. That's what we did in our IVF unit. And for me, but in our unit, the threshold of female age was 35. Okay? And in case of unexplained infertility with women under 35, we obtained pregnancy after a mean of 2 insemination. But if insemination failed, please don't waste time, because there is a risk of dropout, and after you do an IVF. We also look after prognosis factor, and important result is that there is a low rate of fertilization failures. That's why you don't need to do ICSI for this couple, as underlined by ESHRE guideline. And good news, we also look after the obstetrical morbidity in this woman, because we don't explain why she's infertile. Maybe there's something, maybe we will see the problem during the pregnancy, and the obstetric outcome in this woman are the same compared to other group. More to conclude, and more interesting, and we could discuss that, is the unexplained infertility really unexplained? Maybe we need to do some tests to explain it, for example, a laparoscopy, or maybe we are going too fast to IRT, IY, IVF, and we know that a lot of couples have got spontaneous pregnancy after IVF. Maybe when you do IVF, you can explain infertility because there is a poor oocyte quality, and we don't know why there is a poor oocyte quality. And maybe, and I think we will see that in the future, unexplained infertility, and infertility is a warning sign of something we don't know yet. For example, this recent study did a link between genes of cancer and cardiovascular disease and infertility. So maybe that infertility is the first symptom of something we don't know in the woman life. Thank you for your attention. And thank you for your invitation. I'm so happy to be in Vietnam, and thank you, Professor Louis, and all colleagues, and Professor Tam to be here. Thank you.
Thank you, Professor, for your presentation. Để chương trình được diễn ra liên tục và đúng kế hoạch, ban tổ chức kính mời quý vị đại biểu, quý đồng nghiệp dùng chiếc vé tại chỗ